There is a misconception about biopsy and cancer. So today we shall be discussing whether biopsy is necessary for breast cancer or not. The first thing I must tell that biopsy is the gold standard in breast cancer diagnosis. It is rather today is mandatory to start treatment with a biopsy report. Now why so? If we discuss it clearly, that the modalities by which we can detect breast cancer are two. One is FNAC, another one is core biopsy. The other biopsies are incisional or excisional biopsy. Now, since these two modalities are difficult to do and involves a major invasive procedure, that is why the core biopsy is preferred. Now, if we look at the FNAC and core biopsy, if we compare them, FNAC is fine needle aspiration cytology. So, this is a cytology, right? Whereas in core biopsy, we get a core, that means a good amount of tissue. Tissue means multiple cells. So, this is multiple cells, that is histology. So, the sensitivity and specificity is lower with FNAC and it is higher with core biopsy. It is obvious that if you get few cells, then your sensitivity of detecting cancer and specificity is also low. Now, in FNAC, we cannot check ER, PR, HER2/neu, and Ki-67. These are the immunohistochemistry methods by which these parameters are detected, but we can detect it with core biopsy, right? So receptor assessment is done with histology. Now, why this ER/PR, HER2/neu, Ki-67 is important? This is important because to start treatment, we need to know the receptor status. Based on the receptor status, we divide the breast cancers into hormone positive or luminal A, luminal B, then triple negative breast cancer or TNBC, where ER/PR, HER2/neu, Ki are all negative, and HER2 positive, right? So by and large, these are the three groups. Now, if the patient is having either TNBC or HER2 positive disease, here giving chemotherapy prior to the operation is very important. And if we give chemotherapy prior to surgery for locally advanced and even early breast cancers which are more than T2 or node positive, it has been seen that the outcome is better. We can achieve something called pathological complete response, and this pathological complete response is a surrogate marker of overall survival in TNBC and HER2/neu, right? So achieving PathCR is very important in TNBC and HER2/neu group, and that is why your knowing this receptor status is very important before you start the treatment. And that is why all breast cancers we should go for a biopsy, and a proper biopsy is very important to decide which type of breast cancer the patient is having, and based on that we can start treatment. So biopsy is the gold standard. It will not cause the spread of cancer, rather it will help you to treat the cancer properly